Did you know that by age 65, over 80% of adults experience regular lower back pain? But here's what's truly fascinating. In certain regions of Japan, elderly people report significantly less back discomfort and maintain remarkable spinal mobility. Not through pain medications or heating pads, but through simple, deliberate movements practiced throughout their day. If you're over 55, what you do in short moments throughout your day could determine whether you maintain a comfortable, pain-free back, or join the millions who suffer from chronic discomfort and limited mobility due to back pain. I know that sounds dramatic, but this isn't about fear. It's about opportunity. Because these 6 traditional Japanese movements could literally transform your back comfort in weeks. In this video, I'm going to walk you through the first of 6 powerful spine-supporting movements that Japanese elders have practiced for generations to maintain comfortable, mobile backs well into their 80s and 90s. And the first one, it's not stretching or twisting. It's actually a gentle hip rotation that looks simple but rebalances your entire pelvic alignment faster than hours of massage. Most Western practitioners completely overlook it. Exercise 1: Koshimawashi Hip Circles. The pelvic movement that resets spinal alignment. What if I told you that one of the most effective techniques Japanese elders use to prevent back pain isn't stretching the back itself, but a simple circular hip movement that can be done standing, sitting, or even lying down? Koshimawashi, hip rotation, might look like just swiveling your hips, but what's happening in your lumbar spine and pelvic mechanics while you're doing it is remarkably powerful. Koshimawashi has been called the invisible spine reset, and for good reason. According to researchers from Kyoto University's Department of Orthopedic Medicine, gentle hip circling movements help realign the sacroiliac joint, balance tension in the piriformis and psoas muscles, and most importantly, restore proper movement patterns in the lumbar vertebrae. That means it actually helps your body reestablish the biomechanical foundation that supports your entire spine, especially the vulnerable connection between your pelvis and lower back. These are the very same structures that, when misaligned, create the painful tension patterns that many adults over 55 experience daily. In fact, a 2019 study from the Journal of Back and Musculoskeletal Rehabilitation found that adults over 60 who performed gentle hip circling exercises for just 2 minutes, 4 times daily, showed significant reductions in lower back pain intensity and improved functional movement scores after just 3 weeks. But the benefits extend further. Koshimawashi also improves circulation to spinal structures, enhances intervertebral disc nutrition, and helps maintain the crucial mobility of spinal facet joints that often become restricted with age. The beauty of Koshimawashi is that it requires nothing more than rotating your hips in a smooth, circular pattern, no special equipment, no floor exercises, and no uncomfortable positions. Even better, it combines realignment with gentle mobilization. Each circular movement becomes an opportunity to reset your pelvic position while simultaneously nourishing spinal structures through movement. And here's a hidden bonus. The daily practice of hip circles throughout the day creates multiple spine recalibration moments, essentially preventing misalignment from becoming established and painful in the first place. Many Japanese elders perform gentle hip circles during everyday transitions, before sitting down, after standing up, or when moving between activities, creating a preventive approach that's far more effective than trying to address pain after it's already intense. So, while it may look like simple swiveling to untrained eyes, this rhythmic hip movement is working behind the scenes to maintain proper spinal alignment hour after hour. Exercise 2: Tsubo Pressure Waves. The standing wave that releases deep spinal tension. You've probably arched your back when it feels tight, but did you know that a specific Japanese standing wave technique called Tsubo can systematically release deep spinal muscle tension better than many manual therapies? According to a study published in the International Journal of Physical Medicine and Rehabilitation, adults who practiced gentle standing wave movements showed measurable increases in paraspinal muscle relaxation and significant pain reduction after just 3 minutes of self-treatment. But here's the twist. It's not just about arching or bending. It's about what happens in your myofascial system during a specific wave-like motion that moves through your spine. Tsubo pressure waves engage the deep multifidus muscles, thoracolumbar fascia, and erector spinae in a sequential pattern that Japanese practitioners describe as unwinding tension spirals. This technique addresses the fact that back pain rarely stems from a single tight spot, but rather from connected patterns of tension that create painful compensation throughout the spine. But here's what most people miss. The sequential nature of the movement matters tremendously. In traditional Tsubo practice, you don't just bend forward and back. Instead, you create a fluid, wave-like motion that begins at your tailbone and progressively moves upward through each vertebra, like a wave rolling up the spine. This segmental approach ensures that every spinal segment participates in the movement, preventing the frozen areas that often become pain generators. Even better, according to research from Osaka University's Department of Rehabilitative Medicine, wave-like spinal movements stimulate mechanoreceptors in spinal joints that help override pain signals through the gate control mechanism, essentially closing the gate on pain transmission to the brain. This neurological benefit explains why many practitioners report immediate pain relief following the practice. So, forget pain medications. Your mindful movement waves are your medicine for spinal comfort. Exercise 3, Nijiri Hogushi Twisting. The sequential spinal rotation that rehydrates disc. Have you noticed how your back often feels stiffest and most painful first thing in the morning or after sitting for extended periods? This common experience relates directly to one of the most overlooked causes of back pain, dehydrated intervertebral disc. But what might surprise you is that a simple Japanese twisting technique called Nijiri Hogushi can dramatically improve disc hydration better than expensive treatments, all while standing comfortably. Why is Nijiri Hogushi, literally twist and release, so effective? Because it specifically addresses how intervertebral discs receive nutrients and expel waste product. According to researchers from Tokyo Medical University's Spine Center, spinal discs have no direct blood supply and rely entirely on movement-generated diffusion for their nutrition. Gentle twisting creates a ringing effect that Japanese researchers have shown increases fluid exchange in the disc by up to 40% during and immediately after the movement. In a groundbreaking 2020 study published in the Journal of Spine Science, older adults who practiced gentle sequential spinal twisting for just 2 minutes, 3 times daily, reported significant reductions in morning back stiffness and showed measurable increases in overall spinal mobility after just 14 days. The researchers were particularly impressed by improvements in what spine specialists call intervertebral motion segment hydration, essentially, how well nourished and hydrated the discs remained throughout the day. The traditional Japanese approach is remarkably different from conventional twisting stretches. Dr. Hiroshi Tanaka, a specialist in geriatric spine care, explains. Western exercise often focuses on maximum rotation, which can stress already vulnerable segments. Nijiri Hogushi instead emphasizes gentle, rhythmic, segmental twisting that begins with minimal rotation and progressively increases as tissues warm. This respects the spine's natural movement capacity while still providing crucial nutritional benefits to the discs. Here's how to practice authentic Nijiri Hogushi while standing. With your feet about shoulder width apart and knees slightly bent for stability, place your hands gently on your hip. Begin by initiating a small rotational movement from your lower back, as if your navel is drawing a tiny circle. Gradually allow this rotation to expand upward through your spine, segment by segment, until your entire torso is participating in a gentle twisting motion. The movement should feel fluid and comfortable, never forced or jarring. What makes this technique particularly valuable for those over 55 is how it addresses the natural degeneration of disc hydration that occurs with aging. As we age, our discs gradually lose water content, becoming less effective as shock absorbers and more prone to painful compression. By systematically improving fluid exchange through gentle twisting, Nijiri Hogushi helps maintain more youthful disc hydration despite advancing age. The benefits extend beyond disc nutrition. This sequential twisting also alternately stretches and compresses the paired facet joints along the spine, improving their mobility and preventing the restrictions that often contribute to chronic back pain. The movement simultaneously releases tension in the deep rotator muscles that, when tight, can pull vertebrae into painful misalignment. Keiko Nakamura, a 91-year-old from Nara known for her remarkably supple spine despite her advanced age, describes her experience. I began this gentle twisting practice in my 60s when morning back pain started to limit my gardening. Now I practice before rising from bed, after lunch, and before dinner. My spine feels as mobile as it did decades ago, and I garden for hours without discomfort. The neurological benefits of rhythmic twisting shouldn't be overlooked either. The alternating stimulation of left and right-sided spinal nerves creates a balancing effect on the autonomic nervous system. This balance helps reduce the muscle guarding and tension that often perpetuate pain cycles, allowing chronically tight muscles to finally release. For beginners, start with very small rotational movements, focusing on fluidity rather than range. As one Japanese movement instructor advises, imagine your spine as a strand of pearls that you're gently twisting, allowing each vertebra to participate individually rather than forcing the entire spine to move as one rigid unit. As you become comfortable with the basic movement, you can gradually increase both the range of rotation and the number of repetitions. Many practitioners find that 8 to 10 gentle rotations in each direction provides optimal benefits without creating fatigue or strain. Exercise 4. Koshikairashi pelvic tilt. The standing movement that decompresses lumbar vertebrae. Have you experienced that persistent ache in your lower back after standing or walking for extended periods? This common discomfort stems directly from compressive forces on your lumbar spine that naturally increase with age as discs thin and muscles weaken. But what might surprise you is that a simple Japanese standing pelvic tilt called koshikairashi can provide immediate decompression and relief better than expensive traction devices, all while standing naturally. According to research from Nagoya University's Department of Orthopedics, the average person over 60 experiences approximately 30% more compressive force on their lumbar spine than someone in their 30s, even during identical activities. This increased compression doesn't just create momentary discomfort, it accelerates disc degeneration and facet joint where that can lead to chronic pain. The remarkable discovery is that certain pelvic movements can temporarily create decompressive forces that counteract this damaging compression. In an impressive 2021 study published in the Journal of Geriatric Physical Therapy, older adults who practiced standing pelvic tilts showed measurable increases in intervertebral space during and immediately after the movement. Even more impressive, those who performed this technique regularly throughout the day reported significantly less evening back pain and greater comfort during prolonged standing activities. But here's what makes traditional koshikairashi different from typical Western pelvic tilt. Instead of the exaggerated, tucking movement often taught in exercise classes, the Japanese approach emphasizes subtle, controlled movement that focuses on creating internal space rather than maximum external motion. Dr. Takeshi Yamamoto, a spine specialist who studies traditional movement practices, explains, "The goal isn't visible movement but internal sensation. When performed correctly, practitioners should feel a gentle lengthening or opening sensation in the lower back with each tilt." Here's how to practice authentic koshikairashi while standing. With your feet about hip-width apart and knees slightly softened, place your hands gently on your hip bones as reference points. Begin by imagining your pelvis as a bowl of water that you're very slightly tipping forward, allowing the imaginary water to spill over the front edge. This creates a subtle flattening of the natural curve in your lower back. Then, equally gently, tilt the bowl backward, slightly accentuating the curve in your lower back. The movement should be subtle, just enough to feel a gentle opening and closing sensation in your lumbar area. The precision of this technique lies in its subtlety and internal focus. Unlike aggressive pelvic tucking that can actually increase compression if done forcefully, koshikairashi creates decompression through gentle oscillation between positions. This rhythmic movement temporarily reduces the pressure on intervertebral discs and facet joints while simultaneously pumping nutrient-rich fluid through these structures. What makes this technique particularly valuable for those over 55 is how it addresses the compressive forces that naturally increase with age. As supporting muscles weaken and posture changes, the spine often settles into positions that increase compression on already vulnerable structures. By consciously creating brief moments of decompression throughout the day, koshikairashi helps counteract these forces and provides recovery periods for compressed tissues. Masako Tanaka, an 88-year-old from Kyoto who still works in her family's traditional craft shop standing for several hours daily, attributes her remarkable back comfort to regular pelvic tilts. "I was taught this subtle movement by my mother, who learned it from her mother. Whenever I feel pressure building in my lower back while working, I perform gentle tilts for 30 seconds. The relief is immediate, allowing me to continue my work comfortably." The physiological benefits extend beyond simple decompression. The gentle movement also improves circulation to spinal structures, reducing the buildup of inflammatory compounds that contribute to pain. Additionally, the controlled movement helps maintain crucial core muscle engagement that supports proper spinal alignment throughout the day. For beginners, the key challenge is often finding the right balance between too little movement, which provides insufficient benefit, and excessive movement, which can create strain. Start with extremely gentle tilts, focusing on the internal sensation rather than visible movement. As one Japanese movement instructor advises, if someone watching you can easily see your pelvic movement, you're likely tilting too aggressively. The motion should be subtle enough that only you can feel its effects. Practice just 8 to 10 gentle tilts whenever you notice back discomfort beginning to build, typically after 20 to 30 minutes of standing or walking. This preemptive approach prevents pain from intensifying and helps maintain comfort throughout longer activities. Exercise 5, Kata Yude Shoulder Blade Glides, the upper back movement that prevents referred pain. Have you noticed how upper back tension often creates pain that radiates into your lower back, creating discomfort that seems to have no direct cause? This phenomenon, known as referred pain, affects millions of adults over 55 whose upper back mobility has decreased with age. But what might surprise you is that a simple Japanese shoulder blade movement called Kata Yude can break this pain pattern more effectively than many targeted lower back treatments, all while standing or sitting comfortably. According to research from Hokkaido University's Pain Research Center, up to 40% of reported lower back pain in older adults actually originates from dysfunction in the thoracic spine, upper and mid-back, and shoulder mechanic. This referred pain occurs because the nervous system often has difficulty precisely locating the source of discomfort when it originates in areas with fewer sensory receptors, such as the thoracic spine. In an illuminating 2019 study published in the Journal of Orthopedic Research, older adults who practiced shoulder blade mobilization exercises experienced significant reductions in lower back pain despite no direct treatment to the lumbar region. The researchers concluded that improved thoracic mobility created a cascade effect that reduced compensatory strain patterns throughout the entire spine, including the lower back. But here's what makes traditional Kata Yude different from typical shoulder exercises. Instead of focusing primarily on stretching tight muscles, the Japanese approach emphasizes retraining the neuromuscular patterns that control scapular, shoulder blade movement. Dr. Masahiro Ito, a researcher specializing in traditional movement therapies, explains. Western medicine often treats the painful area directly. Japanese traditions recognize that pain often appears far from its actual origin. Kata Yude addresses how poor shoulder mechanics create strain patterns that eventually manifest as lower back discomfort. Here's how to practice authentic Kata Yude while standing or sitting. Begin with your arms relaxed at your sides and your posture comfortably tall. Slowly slide your shoulder blades backward and slightly downward, as if gently moving them toward your opposite back pocket. Hold this position briefly, feeling a subtle opening across your chest and upper back. Then allow your shoulder blades to glide forward again, completing one repetition. The movement should be smooth and controlled, never forced or jerky. The brilliance of this technique lies in its focus on controlled mobility rather than static positioning. Many adults develop habitual shoulder positions that place constant strain on the entire spinal column. By reintroducing proper movement patterns, Kata Yude helps interrupt the compensatory changes that create referred pain throughout the back. What makes this technique particularly valuable for those over 55 is how it addresses age-related changes in thoracic mobility. As we age, the thoracic spine naturally becomes less flexible due to changes in connective tissues and decreased physical activity. This stiffening creates a domino effect, forcing the more mobile cervical, neck, and lumbar, lower, spine to compensate with excessive movement that eventually leads to pain and wear. Yoshiko Matsumoto, an 85-year-old from Nara who maintains remarkable posture despite decades of traditional craft work, describes her experience. I began noticing lower back pain in my 60s that no treatments seemed to help. My neighbor, a movement teacher, suggested I focus on my upper back instead. These simple shoulder movements provided relief within days, and I've maintained them as part of my daily routine for over 20 years. The neurological benefits extend beyond mechanical movement. The controlled scapular gliding activates proprioceptors, position sensors, throughout the upper back that help reset muscle tension patterns controlled by the central nervous system. This neurological reset often provides relief that outlasts the actual movement session, creating cumulative benefits with regular practice. For beginners, start with just 5 to 6 gentle repetitions, focusing on smooth, controlled movement rather than range. Many practitioners find that performing this movement near a mirror initially helps ensure they're engaging the shoulder blades correctly rather than simply moving their arms or hunching their shoulders. As one Japanese movement instructor advises, imagine your shoulder blades as being buttered. They should glide smoothly along your rib cage without sticking or jerking. The sensation should be one of easy movement, not stretching or straining. As you become comfortable with the basic movement, gradually increase to 10 to 12 repetitions, performed 3 to 4 times throughout the day. The ideal practice schedule includes a session first thing in the morning to reset patterns after sleep, and additional sessions whenever you notice tension building in either your upper or lower back.